It's hypocritical, it's illogical, and it's sort of one rule for one and another rule for everybody else.
You must stay at home. Whatever it takes. We will beat the coronavirus, and we will beat it together.
It is the type of breathtaking hypocrisy that makes you understand why the public holds so many experts and politicians and other public figures in total disregard. Professor Neil Ferguson, Professor Lockdown, he was called the man that got us into these draconian measures in the first place as a result of his, I would say, quite dodgy scientific modelling, has been caught not following social distancing procedures. Dr Hilary Jones, as you can tell, I'm heated today. I'm angry about this, and I think the British public are angry. How do you feel about it?
Well, of course, Dan, you can't have people advising the public on what not to do and what to do and then doing something completely different yourself, particularly when it's as drastic as asking the entire population to go into a self-isolating lockdown unless they're key workers and have other reasons to continue at work. So to do this for his own, social gratification flies in the face of everything that we've been told. And of course, it's galling. It's hypocritical. It's illogical. And it's sort of one rule for one and another rule for everybody else. What I would say is that he's a good epidemiologist. He's very highly regarded in the work that he does. And of course, he's not the only scientific advisor that has an input to SAGE, the Scientific Advisory Group for Emergencies. The decision about lockdown was a consensus view of many, many different experts. So at least
was incredibly critical to the whole thing. And if you applied his modelling to the situation in Sweden, which continued with our original strategy, Professor Ferguson said 40,000 Swedes would be dead. In fact, less than 3,000 are. So in fact, can you understand why some politicians like David Davis have come out today and said, in fact, he is responsible for dodgy modelling?
Not really, because Sweden have a real problem in care homes right now. They've had a very sort of what they call intelligent lockdown, whereby people were given the opportunity to go out and mix socially, but to take care. And as the result of that is there's many deaths in care homes, and that's figures increasing. They have a population 10-15% what ours is, and 3,000 times 10 would be equivalent to what we have now. So I think we need to be careful how we compare. And let's see what happens in the States, where they haven't effectively got locked down. They've got the biggest number of deaths anywhere in the world, and it's increasing exponentially. So I think lockdown was actually a good idea. I think it's worked and is still working. So I think the hypocrisy is one thing, but lockdown was correct.
Well, the thing that was so galling about this, though, Dr Hilary, is when Neil Ferguson had to justify this. He did stand down from SAGE, this advisory body, very important advisory body, but he used the excuse, I thought I was immune because he had had coronavirus. Well, if that was the case, then I could be off doing whatever I wanted. And actually, has he now not undermined the very clear messaging from the government by putting this new argument in, oh, I thought I was immune, which now presumably anyone who thinks they've had coronavirus can start using that as an excuse?
Yeah, I think what he meant was he thought he was no longer shedding the virus, having self-isolated for 14 days. I don't think it was quite 14 days, and he wasn't self-isolating. So it was the first thing he thought of, I gather, I would imagine. We don't know how long immunity lasts. He wasn't tested for immunity because we don't have a test yet. So it was an ill-judged thing to say. We hope that people who've had COVID-19 and self-isolate for 14 days can go back to work. In fact, many healthcare workers have already done that. So we would expect there to be immunity, but we can't count on it.
OK, well, I need to calm down, as Taylor Swift would say. So let me move on now to some of your brilliant questions. Linda Brown asked Dr Hilary, I'm a community midwife. We are expected to attend women who want home births. What are my risks being in someone's home for hours?
Okay, well, let's suppose those people have been in lockdown. They've been isolating and only going out for essential things. So the risk of going into their home right now after 6 weeks of lockdown is small. In fact, no greater than them coming to you in the delivery suite and the antenatal care rooms at the hospital. Obviously, they've got other household members there, but if they've all been behaving themselves and acting responsibly, the risk is very small. But of course, I hope that you have the necessary personal protective equipment to assist you in your excellent work.
Claire Lucas asks, I'm pregnant and my granddad is dying at home from cancer. Can I visit through his window? He's about a 20-minute drive away. Is this allowed as he will no longer be here once restrictions are lifted? Oh, Claire, come on, Dr. Hilary, we've got to help her with this.
No, Claire, this is an extraordinary situation, and my view on this would be that you need to care for your grandfather. If he is dying, then clearly he would like to see you before you have the baby. And I think it's absolutely right on compassionate grounds, for mental health grounds, and in this particular situation, that you would be acting as his carer. So I think a short journey and saying hello through the window would be absolutely fine. And, you know, this is not an ordinary circumstance. And I think here it would be fine for you to do that.
Mark Bowdler has sent this in, Hilary.
Hi. As an asthmatic, would it be wise for me to go back to work on a new build construction site if asked to do so? Thank you.
Well, a lot depends on the severity of your asthma. Asthma is listed as a condition that puts you in the vulnerable group. However, that would be especially so if you were taking oral steroids for acute and frequent exacerbations of your asthma. If you only have mild asthma, which is well controlled with inhalers, I think it would be fine to go back to work, but obviously take the extra precautions to keep safe.
Do you have a question for Dr. Hilary? Well, if so, you can use social media and just ask it alongside the hashtag Ask Dr Hilary. We love getting your videos, of course, too. Or you can submit a question at thesun.co.uk/Dr Hilary or at talkradio.co.uk. And Hilary will be back tomorrow answering more of your questions in Coronavirus Explained.